are live now on Facebook and YouTube. Yep, complete. Yeah, hello, good evening, everyone, and how we doing? Trust we are doing great. It's a beautiful evening over here. Let's see who is watching us. Hello, Josie. Hello, Dubem. How are you all doing? Trust you're doing great. Okay, I think we have a lot of people joining on YouTube now. We have a lot of people joining on YouTube. Hello, everyone, and welcome to Nurses Lecture Room Live. I am sorry I am almost 30 minutes late. The live was supposed to start by 9 p.m., but I had to sort my kids out before coming to the live section. So thank you all for joining, and welcome to Nurses Lecture Room. For those that are watching for the first time, my name is Mercy Mary. I am a registered nurse, a registered midwife, and also a public health personnel. Um, if you have not been following us, if you are just coming across this live video for the first time, feel free to subscribe on our YouTube channel, feel free to follow us on our Facebook page and also on our TikTok page. All over, we are Nurses Lecture Room. I think we have more of the followings on YouTube. We have more than 600,000 subscribers on YouTube, which is perfect. This is me saying thank you all for joining the live. Feel free to follow us on all our social media handles. If you have any questions in regards to your health, your general health and well-being, just drop in the comment section and I will be willing to take your questions. All right, so that's what I normally do. I come online to take all your questions in regards to your health, your sexual health, your reproductive health, and your general health. Hello, Amaka. Hello, it's CVK. Hello, Fresh Oma. Hello, Pretty. How are you all doing? Trust you're doing great. It's nice having you all on our live today. So I have the next 1 hour to take your questions on our live video. And if there is a particular topic you would like me to discuss, just drop in the comment section and I will be willing and ready to take it. Hello, Ali. How are you doing? I'm a staff nurse. Hello, Ali. Ali, how are you doing for Facebook? You're a staff nurse from where do you work, Ali? Where do you work? Where do you work? I would like to know. Nice meeting you on our live, Ali. Ali said he is a staff nurse. I would really like to know where you work. Personally, if you have any questions in regards to fertility, feel free to throw on the comment section. It's not just about male fertility, also female fertility. Please drop the questions in the comment section. I'll be willing to answer it. If you have questions in regards to your cycle, your menstrual cycle, just drop in the comment section. So we have Ali from Pakistan and wants to do a master's degree. That is great, Ali. What are your plans towards doing it? Are you a registered nurse with a bachelor's degree or just a registered nurse and you want to do your master's degree? So if you are a registered nurse, you have your BSc, it's just for you to make the necessary applications, and definitely you're going to get a slot to do your master's degree. That's a good one. Uh, I have a bachelor's degree in nursing science, but I have a master's degree in public health because I like public health. I like dealing with the public. There's a lot of things when it comes to public epidemiology and so on and so forth, which we learned during the course of my master's period. So, Sonia Angel, good morning. Good morning. Sonia Angel, is it morning or evening? Over here, it's evening. I don't know where Sonia Angel is, but Sonia Angel, is nice having you on my life. So, we have a question on YouTube, and the question is from Francis Mali. So, we're going to take that questions now. After an ectopic pregnancy, 7 months of marriage, how long can we try again? She took injections to clear it. So, after an ectopic pregnancy, she took injections to clear it. What I would advise you to do first is to go for a scan, just to make sure that there is no leftover. You know what I mean? To make sure everything is cleared out. That's what I personally advise. After a miscarriage, after ectopic pregnancy, if you can, go for a scan. Is an abdominal scan that's to check your uterus and everything to see everything is fine. So if everything is okay, there is nothing left there, then you can start trying again. Immediately she starts seeing her period. Immediately she starts seeing her menses. So you don't really need to wait for years before you start trying again. After an ectopic pregnancy, if it is fine for both of you and everything is okay for both of you, then you can go ahead and try again. So that is my advice for you, Francis Mali. I don't know if your question has been answered. Sonia Angel, I know it was a mistake. I was just kidding. I'm fine. I'm doing great. The kids are sleeping, and I decided to do my 1 hour live. Though I came late because it took me longer for my son to go to bed. Okay, please, can you do a video on delayed ejaculation? Francis Mali, I think we have a video on delayed ejaculation. There was a particular video I made talking about the different types of ejaculation. So we have retrograde ejaculation, delayed ejaculation. We have, let me check, just wait. I know I did a video on the types of ejaculation, and delayed ejaculation is part of it. Delayed ejaculation by nurses lecturing. Just let me see if it's because I've made so many videos about ejaculation. Okay, I think it's premature ejaculation. Let's see how it goes. Okay, what's going to happen? I'm going to try and make a video on on delayed ejaculation in details. But if you want to get just the summary of what delayed ejaculation is, just check on the types of ejaculation by nurses lecture. Let me just show you the video. Let me see if I can get it here. Types of ejaculation. I know we did a video. Or is the video gone? I know I uploaded it. Let me wait. I know I uploaded something like that. By nurses lecture. I know I've made a video on delayed ejaculation. Husband ejaculating with no sperm. 9 ways to cure weak erection. Why is it not showing? I was thinking I made a video on that. I thought I made a video on delayed ejaculation. Okay, what's going to happen? I'm going to make a detailed video on delayed ejaculation. So that's what I can say for the now. I can't find it on my YouTube channel. Somebody asked the question one certain time, and I was like, I was going to make a video on it. So I'm going to try and make like Ella said, I should make a video on delayed ejaculation. I'm going to try and make a video. Hopefully my face will be showing to explain in details what you need to know about delayed ejaculation. Generally, in simple terms, when it comes to delayed ejaculation, the man is unable to ejaculate quickly, like taking longer than expected for the man to ejaculate. But like I earlier said, I'm going to try and see how I can make a detailed video on that particular topic for you. Is that okay, Francis? So expect the video between now and today is what? Today is Tuesday. So you can expect a video between now and next week Tuesday, in a week time. So hopefully just check on the channel, turn on the notification bell. The video might pop up soon, sooner than next week Tuesday, hopefully. So we have Emmanuel from YouTube. Emmanuel, how are you doing? Trust you're doing great. It's nice having you on our live. Francis, just let me know if your question has been answered. Sireye Emmanuel said, please, is masturbating good or bad? That is masturbating good or bad? This is actually a two-way thing to it. You get it's a two-way thing to it. Because how do I put it now? I can't say it is good and I can't say it is bad. But one thing I know is that too much of everything they say it's bad. In terms of some religion aspect, as a Christian, masturbating is bad. You get, but generally in terms of health, they tell you it is good. It has some health benefits because it's advisable for men to ejaculate frequently. And when men ejaculate frequently, it reduces the risk of prostate cancer. You understand, Emmanuel? So, as a Christian, to me, it's bad. But in terms of health-wise, there are a lot of benefits associated to it. But there are also disadvantages of masturbating. I've made a video on my YouTube channel talking about the disadvantages of masturbation, so you know. And I've made a video on my YouTube channel talking about the benefits, the number one benefit why men should masturbate. I've made a video on that. And I've also made a video on, I've made a lot of videos on masturbation. All you just need to do, Emmanuel, is to check on our YouTube channel and get the full video. So Emmanuel said, yeah, I understand. Okay, that's good. But if you want more detailed on the disadvantage, the negative side of masturbation, check our YouTube channel, we have it. Just type what you are looking for and include by Nurses Lecture Room, it's going to pop up. Then if you want to know the reason why you should masturbate, why it's important to masturbate, also check on Nurses Lecture Room. You're going to get a detailed video. Because generally for surrogacy, IVF, definitely masturbation is one of the way they can get the sperm for fertilization to take place. So that's that. So Emmanuel, I don't know if your question is answered now. Emmanuel, can you let me know if your question is answered? So I'm done answering Emmanuel's question. Let's keep the questions coming. So that's why we are here. So let's keep the questions coming. Emmanuel said he understands now, so there's no problem about that. Okay, yes, you're done. That's good. So there are a lot of, everything that has advantage has disadvantage. Everything that has a benefit definitely has some side effects. Even the paracetamol you take has some side effects associated with it. So there's something I want to discuss why this live section is going on, and also this particular what I want to discuss is about. Let's see. Sorry. Okay, Esther said we have a question from TikTok, and Esther says, "Do you know any specialist I can go for chronic catarrh, which results to bad breath? Chronic catarrh, which results to bad breath." When you say chronic catarrh, does it mean you are always like the mucus from your nose is a lot and it's something that happens regularly, like frequently? So what I would advise you to do personally is for you to see a respiratory specialist, like those people that deal with the that's the upper parts of those people that deal with the lungs generally. So they are able to look at what is really wrong with your respiratory system and all that. And while you are doing that, you can have some ginger, garlic, turmeric, all those natural things, they are good. But see a doctor to check that everything is fine. And if there's anything, they should actually sort it out. So it's not something you should just keep to yourself. And for the bad breath, you can use some meats. Yeah, some meat gum for the meantime to keep your breath fresh. And try and see how you can brush, if possible, 2 or 3 times a day to keep your breath fresh. Since personally you observe that it's actually smelly, it causes bad breath. So you have to keep that breath fresh for your own like self-esteem and everything. So while you are at it or visiting a doctor to do a checkup, you can just make sure you brush frequently, if possible 3 times a day. I know it's too much, but if you can do that, then also chew gums like meat to keep it fresh. You get that is going to help a lot. Because I know when one has bad breath, it actually has a way of affecting our self-esteem. When we go out, we are scared of speaking out, we are scared of talking because we feel people around us are not safe, people around us are going to like run away from us. So it's very important to still look at that side and do the little you can, Esther. So is that clear, Esther? Please, Esther, try and see a doctor because things like that is not good for your respiratory system. So you just see the doctor to get it all sorted out, then try taking some natural things like ginger, garlic, all those things help generally to reduce inflammations and all that. Okay, Esther said, okay, ma, thank you so much. You're welcome, Esther. Feel free to like the video, Esther, and don't forget, just feel free to like the video. Let's keep the questions coming. Like I earlier said, I have 1 hour to spend on our live today. So we just have 60 minutes and we still have a lot of time. You're welcome, Esther. So while we are done with all the questions, let me go back to what I want to say. This is especially for teenagers and young ones out there. I'm talking about young ones in the secondary school and also probably in the university too, not just secondary school, university that are not planning to get married and also that are not planning to get married now. I'm not talking about the future that are thinking of okay, they want to date someone and they want to start having sex and things like that. This particular discussion is for them. So if you have any young one, it's advisable for you to let them join the live video because I want to state something. I've made like 2 different videos on this particular topic and it is very important for we to talk about it. So most times as a young girl, for example, I'm going to use myself as an example. For example, I am a young girl. Like as I grow older, my body starts changing. Every month, as a young girl, you notice that oh, there's this particular time of the month that your body just changed. You need somebody to hug you. You need it like somebody of the opposite sex, but especially girls that are attracted to guys of the opposite sex because these days we see people attracted to same genders and all that. So there's a particular time of the month that you are generally attracted. You just want the person of the opposite sex to be with you, to talk to you, to love, say I love you, to cuddle you, and things like that. So these changes happen every month, and you notice it as a lady. So also when you go to school, you see your girlfriends, you see your friends, your peers. I'm talking about the secondary school and university people now. You see them, they are having their boyfriend calling them, their boyfriend sending messages, and you are feeling left out. And you want to feel among. It's actually good to feel among. It's actually good to feel, okay, I am part of them. But there's something I usually say before you start having sex as a young girl, as a young teenager, there are some things you have to take into consideration. There are some things you have to put at the back of your mind before you start thinking about having sex. It's not just about rushing to go and have sex. That's just it. Sex is like 5, 10, 15, 20 minutes, highest 1 hour enjoyment, and it's all gone. 1 hour pleasure, and it's all gone. So it's the aftermath effect that actually matters a lot. So first of all, if you are a girl and you want to start having sexual intercourse, okay, the first thing you should consider is who are you having it with? That is one thing you should ask yourself as a young girl. Who are you having this affair with? Who are you having this sexual intercourse with? because we are so quick to like free our body to people out there. Like, okay, yeah, I want to have sex. I want to feel among anybody that comes my way, good and fine. I'm going to like stick with this person, and we are going to have sex, and we're going to be together. But the first thing is, who are you having this sexual intercourse with? And also, before you start having sex as a young lady, there's something you should even put at the back of your mind. Is it really worth it? Is it really worth it? I know these days, like, oh, is it really worth it? Is it really, really worth it? Ask yourself this question. Yes, I want to start having sex. I'm young. I'm just, these days, 10, 11, 12, 15, 16 years. Is it really worth it? You want to have sex. Is it worth your time? Is it worth your career? Is it worth everything? Then if you feel within you that you really, really want to, it's worth it. Okay. The next question you should ask yourself is, do you want to get pregnant? Yes. Do you want to get pregnant? If you now finally agree, for example, you said, yes, I want to get pregnant, fine. Then if you now say, I don't want to get pregnant, what if you want to have sex, but you don't want to get pregnant? Then the next question you should ask yourself, what if mistake happen and I get pregnant? Will the person I'm having this sexual intercourse be responsible enough to take care of the child I'm going to give birth to? Will the person I'm having this encounter with be responsible enough to say, yes, I got you pregnant, keep the baby, I'm going to take care of you, I'm going to take care of the baby? Would the person be there with you during the long term? Would the person be there with you during that long run? Or else, if they are not going to be there with you, then you should program your mind that, okay, am I ready to be a baby mama? Am I ready to have kids outside wedlock? Am I ready to have kids without their father being in place? Then if you are ready to have kids without their father in their life, that is fine. Then you can go ahead and have sex as much as you like, as much as you can. And generally, on the other hand, if you don't want to get pregnant, the next question you should ask yourself as a lady who is having sexual intercourse and don't want to get pregnant is, do I know my cycle? That's the first thing you should ask yourself. How well do I understand my menstrual cycle? What do I know about my menstrual cycle? Do I know my safe days? Do I know my unsafe days? Do I know when I'm safe and when I'm not safe? You get? Because I've seen people, it's their first time. Their body was dancing to hormones they know nothing about. And that particular time is their peak period. And that particular time is their ovulation period. And they don't know that it was their ovulation period. They just, during that period, they just want cuddle, they just want everything. And finally, they got pregnant. The rest is story. And you hear things like, oh, I'm not going to have sex again in my life. This is a big mistake. I regret ever doing it. I understand how you feel. But before you take that big leap, there are some certain questions you need to ask yourself. If all these things you're going to take, it's worth it. You get it? And also, looking at the way inflation is going, I believe you don't want to have kids that are going to suffer. I believe you don't want to have kids that will look at you and like, oh, I don't like the fact that my mother brought me into this world. I hate you, mother. Why did you bring me to this world to suffer? So there are some things you just have to consider before considering like having sex at a very young age. You have a career to chase. You have a career to capture. So I don't know why the haste or why the hurry. You get. So I just feel like as young ladies, I'm not an advisor. If it's possible, try and calm down. Try and calm down and take things one step at a time. Okay, so that is that. I was just diverting since there was no question. So I'm going to be taking the question. There's another question on YouTube, and it says, does being sickle cell affect your sperm health? I've not really thought about that, but I don't think so. Sickle cell doesn't affect your sperm health. No, it does not. Yeah, it does. Sorry. It does. Because I had to check. I've not really thought about the impact of sickle cell on sperm production, but I found out that sickle cell can affect sperm production and quality potentially impacting male fertility. Many men with sickle cell disease have sperm abnormalities, including lower sperm count, reduced sperm motility, and increased abnormal sperm morphology. So, Francis, sorry for that. I think you've gotten an answer to your question. Yeah, people with sickle cell, um, their sperm is being affected. The morphology, the count, and also the motility, that's the movement of the sperm. So, with those. So, Francis, did you get answer to that question? I was actually thinking that sickle cell does not affect sperm health, but now I know better. It does affect sperm health. So we have Bibi Joe says, excuse me, nurse, can you answer my question? Bibi Joe, what's your question? I can't find your question in the comment section, Bibi Joe. I've answered all the question on TikTok, but if you know, I can't see your question, but feel free to drop the question on the comment section and I will take it. So if an individual is sickle cell, it affects their sperm health. So that's something, that's a take home, not just for you alone, but also for me. Now I know. From what I just read, it affects the motility, it affects the morphology, and it also affects the sperm count. So Francis, is that clear? And Bibi Joe, kindly ask your question in the comment section. Okay, Francis Mali, are you sickle cell? Are you sickle cell? Francis? Okay, Gigi said, my TikTok is new. I don't think I can join. I think I know Gigi. Gigi, is it your sales wife? Please let me know in the comment section, Gigi. Gigi, kindly let me know in the comment section. Because I know, I'm thinking it's Ose's wife. I knew it. Thank you very much, Gigi, for joining the live. Thank you very much. Okay, Francis Mali. So we're having a question from Francis Mali, and he said yes. So what I would advise you to do, Francis Mali, is to actually see the doctor, discuss treatment option. Sometimes they will advise for sperm banking before certain treatment can take place. But I think you should speak to a gynecologist and a fertility expert, not a gynecologist, a fertility expert in regards to that. The earlier you do it, the better for you. So that's what I would advise you to do. Don't just, especially now that you're trying to conceive. So what I would advise you to do is to go and see a fertility specialist, the fertility expert. I mean, people that that deal with issues in regards to fertility. So when you meet them, you discuss your issues with them. Let them know you are trying to conceive, but you have sickle cell, and see what they can do about it. So that's what I would advise you to do, Francis Smiley. Hello, Big Mama. How are you doing? Thank you very much, Gigi, for joining, and thank you very much. I really appreciate it. How's my baby? Hope they are all fine. So I'm actually going live on both Facebook, YouTube, and TikTok right now. So I'm using my camera for Facebook and YouTube. So this is my phone. Why I'm using my phone for TikTok live, just in case my eyes are moving here and there. And the questions are on the computer. So I'm reading the questions from the computer. So that's why my eyes are moving and not really moving. I'm not looking straight into the camera, just in case. Thank you very much, Gigi, for all the likes. I really do appreciate. So, Francis, just let me know if your question has been answered, Francis. And I would like to know what you've done so far in regard. Okay, Francis said his question has been answered. Good to know. So I would like to know what you've done so far. If you would like to talk to me, this is something I'm interested in. If you would like to talk to me, just send me a message on my Instagram handle. Then we can just discuss about it. Though I'm not a fertility specialist, but I think I'm interested in that. Um, I think I'm interested in it. Just send me a message on Instagram, Nurses Lecture Room, then we can discuss further. And also, it all depends on where you are located. That's going to determine the type of fertility expert you're going to get. That's also going to determine the type of treatment you're going to actually receive. And it also determine your finance too. Sorry. Your finance is going to tell what is going to take place. So that's that. Francis, thank you. You're welcome. Thank you for joining our live, and I'm glad that um, um, your question has been answered. So, hello, Ma. Your voice is echoing. We'll just try and reduce the echo in the mic. Hopefully, it doesn't echo anymore. Okay, is it better now? So, Anthony said my voice is echoing. Kindly let me know if it's better now. I've reduced the echo in the mic. Kindly let me know if the echo is better now. Anthony, is this the echoing? Okay, it's better now. Thank you very much. Thank you very much. Glad it's better now. So we've been able to take as much questions as we can, and I am still here to take questions. Like I earlier said, I have 1 hour. We came late, so that's why um, the life is supposed to end now. But since we came late, it's going to be extended to 20 something minutes time from now. We still have 30 minutes to go. Thank you, Gigi, for all the love. I really do appreciate you very much. Thank you. So Francis said, I am not on Easter. So let me see if I can drop a message. Hopefully you get it. I'll just drop a contact number for you to reach. Then with that, you can book an appointment. Just Francis, are you in Nigeria? I'm just going to use +234. Okay. I don't know if the number is showing, but okay. So Francis, that is the number. Contact that number on WhatsApp, and we will try and give you some information. Just contact that particular number on WhatsApp, Francis. Send a message to the number on WhatsApp. Yeah, just send a message to the number on WhatsApp. And I also like to know if you married, what is the genotype of your partner? Is it AA or AS? These are also things we need to take into consideration when you are trying to conceive. So that's the number on WhatsApp. Feel free to send a message to the number. I will see how soon I can reply. I'll try as much as possible to reply on time. Just let me know it's from Francis on YouTube. Just let me know it's from Francis on YouTube. Okay, Francis is from Ghana. Oh, okay. All right, Francis. So should we go back to our previous discussion, or we still have a lot of questions, or we still have more questions? So if you are watching, this is the first time coming across Nurses Lecture Room on YouTube, on Facebook, on TikTok, what I would advise you to do is to subscribe on YouTube, follow us on Facebook, and also follow us on TikTok. Okay. Due to normally I do upload videos regularly on YouTube, but due to my busy schedule with kids and everything, I'm just trying to work around what works best for me. And for the now, coming on live is much more easier for me to take your questions, because under the comment section of my videos, there are a lot of questions that I cannot attend to. So the best thing I just do is to come online during this 1 hour. Normally, it ought to be 9 to 10, and take as much questions as I can. That's one. And also, what have been able to work for me is the fact that I make my videos with my voiceover, and I upload. So for those that have been following me on YouTube, you will notice that recently my videos, my face don't usually appear on my videos. My face don't usually appear on my videos. That is because I do a voiceover and try to explain or answer the questions I am being asked. So the only way you get to see my face is when I go live. So that's how I've been able to walk around it. This is me still showing up, and this is me still like showing up my face and still being productive in the long run. Hello, Mark Gloria. That's my cousin. Hello, Mark Gloria. How are you doing? Trust you're doing great. It's a beautiful evening over here, and I hope it's a beautiful evening over there. You don't need to tell me. I know you are the one. How are you doing, and how's the family? Hope they are all doing great, Gloria. Yeah, it's not my fault. I have been choked up, so this is the only way I have to like come online to stay consistent. Yeah, by going live, because with the live it's much easier for me to show my face, because it takes a lot of time for me to like draft that content, shoot and upload. So in order to stay consistent, I want to do more live while the kids are sleeping, because for the now I have been able to sleep train my 5 months old. He's 5 months old today. He's 5 months old today, and sleep training him was more or less like the best thing I could ever do. Doesn't mean that he sleeps throughout the night, but one thing is sure is that when he sleeps 8 or 9, that's why my life starts 9. So when he sleeps 8 or 9, when he just wake up maybe 12, 1, it's just to eat and go back to bed. So which makes everything easy. So he wakes up 6 a.m. So I know from 9 o'clock I have the whole time to myself to do anything I want to do. So sleep training them, I think sleep training him at a very young age is going to help me. Same way I did with my daughter, and sleep training her makes life much easier. So that's it. So this is me trying to stay consistent, and this is me showing up despite my busy schedule, because I love my followers. All right, thank you all for joining on our live. We have Beatrice at UK joined. We have Esther, we have Stephen Vander, we have Gigi. Thank you all for joining our live today. We really do appreciate. Everybody is fine, Gloria. We are all doing great, Gloria. Everybody is fine. How are you doing? And have you been able to sort out your internship? I believe you are planning for your internship now, or you are already on it, or you. Okay, I think this live has to end now. I'm going to come back